Stay back! God damn it, I will teach you.
Oh, well, nope, just jump and bite somebody's brains. Terrifying school assemblies, what not to do during a house fire, and other nightmare-inducing injuries you won't find in any medical textbooks. Today, we're back breaking down and reacting to the most haunting and straight-up disturbing medical scenes from It. Welcome to Derry. Let's dive right in.
Pennywise the Dancing Clown. Kiddos!
Oh, he was using it as a puppet. Oh my gosh. I always thought it was interesting, Pennywise. Head is big. Like, he has a very big cranium. It's not just because he has a big brain and he's using it so much. His irises are orange. I haven't seen anybody with orange irises, which is the color part of the eye. Impaling right into bilateral eyes. Could you actually do this? Yes. Eyes are mostly filled up with fluid. You can puncture through it and squeeze all that fluid out. It's really hard to get it back in. There is some synthetic that doctors can use, but you really don't want to have an open globe injury. Okay. Could you pull somebody's head right off like that? Probably not. Maybe a little like breaking of the bones where you're trying to pull the head off from the superior orbital wall. Oh man, okay. Ripping the major blood vessels of your neck. You should see some arterial spray going on if he was still alive. But if he was already dead and his hand's already in his back, then of course your heart's not pumping, so you're not pumping blood, so you wouldn't have arterial spray. It would all just kind of pour out. Never good when you get lit on fire. Don't just stand there and wave your arms, stop, drop, and roll. The fire will continue to go up, and then it's going to impede in your airway. You're going to potentially swallow the flames, you're going to burn your airway, you're going to melt your airway shut, and then you're not going to be able to breathe. Remember also, smoke rises. If you want to get out and not suffocate from the smoke, make sure that you're lower to the ground. Most common burns that we do see in the ER, usually second-degree burns, because a lot of people don't come to the ER for first-degree burn. If a burn hurts in a weird way, it's good because you're going to most likely heal. If a burn doesn't hurt and it's like, it looks like charred skin, then it's most likely a deep second or third-degree burn that needs therapy, aka a skin graft.
What's the matter? Do I have face on my face?
Eating flesh, raw flesh, you always worry about like disease processes within the blood. If you're eating brain, you increase the risk of getting Kuru or prion disease. It has to do with the proteins. Obviously, if you're drinking their blood or ingesting excess amounts of blood, increased amount of iron, hemochromatosis. Oh, look at those teeth, how jacked up they are. These are all considered almost like canine teeth. Skin looks pretty bad. We're missing the soft tissue of the nose here. As a human, usually that would occur due to cancer, some vascular abnormality, or syphilis.
Stay back! God damn it, I will teach you.
Oh, well, nope, just jump and bite somebody's brains. Oh, the bullet goes through and then explodes out the one side. So that's where you see all the tissue and the bone fragments being lost. And that's actually what ends up happening. You do have blood in and around the brain, but when you see depictions like it in this way, it almost looks like you just have a head filled with fluid, which it doesn't look like that. Whoa. Cool. You're seeing just like splattering of blood everywhere. There's no tissue. Maybe Pennywise doesn't have a brain in there. Most of this would be like gray and white matter, which all looks kind of gray. You'd see tissue and bone fragments flying around. Look at the blood. It's like floating in the air. What? That is crazy. If a body is decapitated, your body wouldn't move like that. Yes, you could still have some action potentials or movement of the muscles, but they're more like twitching and flexion versus like purposeful movement like this. Whoa. Whoa. Whoa, 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 whoa. What's happening? Whoa. Skin just peeling off somebody's face. We see something like this. It's almost like a degloving injury. I've seen it with somebody's scalp. I've seen it with somebody's hand before. It's almost like the skin just peels off of the bone. You can put it back together. All of the vessels and the nerves are still all intact. Yeah. Interestingly enough, our skin does that. It will shed itself off very slowly. The fingernails, they'll just continue to grow and we need to trim them. We do have multiple layers of tissue. Your skin, you got the subcutaneous tissue, fat layer, the fascia, muscles, and connective tissue under that. If creepy sewer scenes like this has your stress levels spiking, that's where Chillax from my company Life Happens could come into play. Designed to help you stay calm when life gets chaotic and unrelenting. Find Chillax at lifehappens.com or on Amazon. Oh, sounds are awful. Hey! Oh, to the forehead, straight through. Now, if it goes straight through the hemispheres, it might miss everything, but it could cause the bleeding in the skull. So you're still having the issue relating to the bleeding. Your brain might be intact, but you have bleeding within the skull. You increase the risk of infection, as well as the swelling related to the brain and the inflammatory response. She's got a gunshot wound to her head and she's hanging out in sewer water. You're definitely going to get prophylactic antibiotics, but even then, will it be enough? Because now you just have gross water inside the brain floating around in there. Likelihood of a good outcome, probably pretty low. Pulled under the water, increase the risk of drowning or near drowning. Difference between near drowning and drowning. Drowning you die from, near drowning you do not. All can cause fluid to go into the lungs, which inhibits gas exchanges, oxygen and CO2. Whoa. It's a lot of sputum, white stuff. That's real thick. That ain't normal. Most of the time, we do have people who spit up a lot at the hospital, but we have suction catheters and we wipe this stuff away pretty good.
Get help! Get help!
We got foaming at the mouth, dehydration. Maybe he's got rabies. Maybe he's got congestive heart failure. Even in this position with the head back like this, you increase the risk of messing with your airway if you have that much sputum. When people have URI type symptoms, upper respiratory symptoms, and then they complain of sore throat, you can see some cobblestoning going onto the back of the throat. Saliva is just sitting there and causing the back of the throat to be super raw and painful.
Get him to the infirmary, now.
Cyanide poisoning. Took something, he took something.
I'm fine. I'm fine.
Really sweaty. We would call that diaphoretic. Many reasons why. Fevers, respiratory issues, pulmonary issues, cardiac issues, hormonal problems. A lot of things can cause somebody to be excess sweating to this extent. So you do a full workup relating to that. Definitely check your thyroid out. With all that sweating, you do increase the risk of dehydration as well. If you guys enjoy this, let me know. And as always, definitely binge watch this playlist, watch everything, and do me a favor, please subscribe. We need you guys to subscribe, keep the channel growing, and please hit your like button and your bell notifications. Thank you so much for watching and stay healthy, my friends.